Hi everyone, this is the final video in the series of videos we've been doing focusing on your understanding of vital sign. And in this particular video, we're going to be talking about oxygen saturation, or simply oxygen level. And what is your understanding of it, and how you could manage or how you could determine what to do when your oxygen level doesn't feel right, or when you're having some strange feeling in your chest. You're not sure, are you having a heart attack? Is this your oxygen level? What is going on? We're going to be talking about that. I'll also be talking about pain levels as well as one of the other vital signs. As we wrap this series up, I'll be right back. Welcome back to our YouTube channel. My name is Dr. D. Terrence Foster. If this is the first time that you're joining me, let me just extend a very warm welcome to you. Wherever you are in the world, welcome. And I want you to know that on this channel, we focus on simplifying medical issues for everyone, particularly those who may have felt left out. This is your channel. Consider subscribing. It is free, and we produce a new video every week. So let's begin. Let's talk about oxygen saturation. What is oxygen saturation? Also referred to as SpO2. This is the percentage of hemoglobin that is bound to oxygen in red blood cells. Usually when we measure this, it's measured in the arterial blood. So what is hemoglobin? Hemoglobin is a protein molecule within red blood cells. Structurally, each hemoglobin molecule is a combination of 4 proteins called globin subunit, contains iron. And that's of course how we have the structure hemoglobin. Now each hemoglobin protein can bind up to 4 oxygen molecules. However, it does not always bind all 4. It could bind 1 or anywhere from 1 to 4. However, of course, if it binds all 4, then that part of hemoglobin would be 100% saturated. So what is the functional role of hemoglobin? Hemoglobin is primarily responsible for transporting or carrying oxygen throughout the body. And this occurs for about 98% of the time. The other 2% is facilitated by oxygen dissolving in the blood plasma. And the blood plasma is a liquid part of the blood. Now the pressure resulting from the amount of oxygen dissolved in the blood plasma is called partial pressure of oxygen, and it's abbreviated PaO2. Now another role of hemoglobin is that it's also transport carbon dioxide to the lungs for expiration. However, this is not the most significant role of hemoglobin. Most of the carbon dioxide transported is by a system called the bicarbonate buffer system. Now, what does all of this mean? Let us examine and take a look at a few important definitions. Number 1, what is hypoxia or hypoxemia? Hypoxia is a deficiency of oxygen supply reaching the tissues of the body for normal function. In other words, you have a limited or you have a smaller than normal amount of oxygen reaching the tissue, so it's unable to perform its normal function. And then there is hypoxemia, which is a low or inefficient amount of oxygen supply available in the arterial blood supply. Now sometimes hypoxia is referred to deficiency or insufficient amount of oxygen supply for the tissue as well as in the arterial blood. So sometimes that definition is also there and is used in that manner. The next thing, what is oxygen? It seems almost basic, but oxygen, we all should have a sense of. It's a colorless, odorless, and tasteless gas. So you can't smell it, you can't taste it. It's considered, it is the 8th element in the periodic table. It is essential for life, and without it we cannot breathe, we cannot live. You'll just know when you're not having enough of it, because that's when you'll start becoming symptomatic. Very important for the existence of life. Now, what is a normal oxygen level, you may be asking? A normal oxygen level is between 95 to 100%. You're considered to be poorly oxygenated or have a poor oxygen saturation if your O2 sat is 92% or less. Now, if you're below 90%, then you're considered to be in a danger zone and usually require emergency care. Now, these numbers, of course, refer to patients or individuals who are not on supplemental oxygen. If you're on supplemental oxygen, depending on your condition, you may be able to tolerate oxygen at the level of 92% and even at 90%. However, these are not ideal conditions. Ideally, you want your level to be as close as to the normal range as possible. Now, what happens when we breathe air or oxygen in? Breathing or ventilation allow gases to be exchanged during inspiration and expiration, moving air in and out of our lungs. And in the process, we also are extracting oxygen and expelling carbon dioxide. But also, what's important to note in this process is that when we are breathing air in, we are breathing in air which contain 78% of nitrogen, 21% of oxygen, and 0.9% of argon, A-R-G-O-N. Now, all those are gases. Now, but in addition to those, we're also breathing in a small, very minute amount of carbon dioxide, usually 0.04% of carbon dioxide, along with a number of other trace elements. And when we're breathing out, after we've extracted our oxygen, we're breathing out the same amount of nitrogen, 78%. We're breathing out, however, now we're breathing out less oxygen. We're breathing out 16% of oxygen. And now we're breathing out about 100 times the amount of carbon dioxide that we breathe in. We're now breathing out 4% of carbon dioxide. And the trace element will still be breathing those out as well. So the important point here is that our system is very efficient in extracting the oxygen from the air that we breathe in. Now, in general, oxygen is free and it's in the air, but there comes a time when the environment or our body doesn't cooperate anymore. In other words, there's something in the environment which makes it difficult for us to fully utilize the oxygen that's available, or there's some disease process which makes it difficult for our body, and it's no longer free. We now have to buy oxygen to sustain our existence or our life. Now, environmental factor could be, for example, if you are at a very high altitude, say in the mountains where the oxygen level is less than it is at sea level, then your oxygen need will be higher. Other environmental factors could be like toxin or chemical or gas poisoning, such as carbon monoxide or cyanide or pollen. All these are things are allergic reaction which cause constriction of the airway, which reduce in the amount of oxygen available to you. The issue of carbon monoxide is one which is also very important because carbon monoxide has a greater affinity for hemoglobin than does oxygen, about 200 to 300 times more. And also it's a colorless, odorless gas which cannot be detected by human senses. Carbon monoxide is one of those special cases as well where it has a greater affinity for hemoglobin and binds very tightly, much so than oxygen, and resulting in the formation of a compound called carboxy hemoglobin. And if you were to be in a situation where even if you have a pulse oximeter and you try to test your oxygen, you would not be able, you would still have an apparent normal oxygen saturation, even though you are being poisoned by carbon monoxide. So it's a very dangerous and it's a very dangerous and significant poisoning that one should be aware of. Now, with respect to tissue hypoxia and hypoxemia, there's so many diseases that could affect this. Of course, the most obvious one, of course, is the lungs. any diseases that affect the lungs, from pneumonia, cancer, COPD, asthma, anything that affects the lungs will lead to hypoxia. So that is pretty straightforward. Now, medication is another factor, and medication that suppresses or interfere with the respiratory center will affect the oxygen saturation, as will some illegal drugs will. If you have a cardiac or heart condition, such as arrhythmia or congestive heart failure, all these conditions can lead to adverse effect in lowering the oxygen saturation. Other condition is if you have lost blood, you're anemic, whether it's from a GI bleed or from trauma or wound, or however you have lost blood, that could also be a significant factor in leading to decreased oxygen saturation. So be aware of that as well. Now, there are a number of symptoms that you could have as a result of low oxygen saturation, such as you could have shortness of breath, chest pain, tachycardia, headache, altered mental status, low blood pressure, dizziness, and these are just some of the things that you could have with low oxygen saturation. When we did the last video series, we talked about respiratory rate and elevated respiratory rate or low respiratory rate, and some of those conditions that are also associated with change in respiratory rate, whether elevated or low, is also associated with low oxygen saturation as well. Now, how do we measure oxygen saturation? The most common way to do this is by a single finger method, where the measurement is taken by any one of your fingers. Now, studies have shown that the most accurate way or the most reliable way is the middle finger on the right side of the body. Now, all the difference, however, is not that significant. So any finger will provide good reading with respect to obtaining the oxygen saturation. Another way is by an arterial blood gas, where you'd have a needle stick into an artery, which is usually very painful and much more invasive than measuring by the finger method. You could also do a pulmonary function test, among other tests that are out there that are used to obtaining oxygen saturation. Now, let's look at pulse oximeter. And a pulse oximeter, what is a pulse oximeter, or what is pulse oximetry? Pulse oximetry is a non-invasive method of assessing or monitoring a patient arterial blood oxygen saturation. Or it also helps to assess patient respiratory function or their respiratory state, and basically measuring how much hemoglobin, essentially measuring how much oxygen the hemoglobin in your body is carrying. That's what the pulse oximetry does. Now, in addition to measuring your oxygen saturation, the pulse oximeter also measures your heart rate as well. So you'll have two very key component of the vital sign that you will have to help to assess your patient in almost all oximeters that are available. Now, how does this work? How does pulse oximetry work? Now, there are millions of hemoglobin molecules in a single red blood cell, and then there are millions of red blood cells. The hemoglobin saturation of oxygen is the average saturation among all of these bounded protein. Therefore, although each hemoglobin protein can bind 4 oxygen molecules in any given one time, it may not be all 4 at any time. Some may have 1 protein, or anywhere between 1 to 4 protein. Now, because of the varying degree of saturation of hemoglobin that exists in the blood, there will be different wavelength of light that is absorbed through the blood, and therefore pulse oximetry is able to use this property to calculate the average saturation of the blood. There's some problem that could affect the measurement of oxygen saturation. Be aware of low blood flow, particularly distally, in this case the finger tips. Be aware of long fake fingernails, as well as nail polish. All of these could affect the pulse oximetry reading. Now, how do we treat hypoxia? This will be determined by the condition or the type of hypoxia, what is generated, as well as the severity of it. Now, if it's a case where it's environmental and the identified cause can be removed, then that would be the ideal situation. Generally, oxygen is important and will help in alleviating the problem, or the hypoxia in this case. Now, sometimes just simple nasal cannula or mask might be adequate, but other times you may need mechanical ventilation, depending on the level or severity of the insult or the cause of the hypoxia. Additional management that should be taken into consideration: some patient may be able to benefit from medication before or during the attack of an hypoxia, or in some cases preventative measures should be taken. If you're a person that are prone to be hypoxic or have shortness of breath or have any underlying conditions such as asthma, COPD, then be aware of these and make sure that you have your medications available that will help you when you become hypoxic or short of breath. Those will be important. Now, of course, when in doubt with any of these hypoxic conditions, shortness of breath, always consult with your medical provider, who could give you some guidance. Hopefully they'll know what your history is and what your condition is. If you can't get to them, and of course always feel free to go to the emergency room, because in a lot of cases with shortness of breath, those conditions can deteriorate very quickly. Now, so one of the questions that often comes up is, should you have a pulse oximeter? And generally I would say yes to this question, but of course there are different type of pulse oximeter that are available. Some are very basic and some may not be as accurate. A good rule of thumb is, if you get one, you could take it with you to your medical provider, and you could just do a side-by-side comparison and see what your oxygen saturation is when you do a side-to-side comparison with their instrument. Now, another thing is that a lot of times when you get these readings, if you're not familiar with what you're doing, it can cause more problem than not. However, generally, if you understand the basics of what this is saying, or what other people are saying about pulse oximeter or oxygen saturation, then it could be of help to you. Particularly if you are one of those persons who are on oxygen at home, or you have a pulmonary condition or any condition that is going to cause you to have shortness of breath or impaired lungs, impaired breathing, then yes, and a pulse ox or a pulse oximeter would be very useful thing to have. Everyone should have a thermometer at home. Everyone should have a blood pressure monitor at home, as well as a basic emergency kit. Those things are indeed good basic thing to have in your home. Just to repeat, a thermometer, basic emergency medical kit, and of course a pulse ox. And you could get fairly good pulse ox ranging at about $20-25. So they're not crazily expensive. There are some that are much more expensive, and of course you'd see those in clinics where some are more electronically based, where they're attached to machines, and you don't need anything that expensive or that fancy, so to speak. But you could definitely find good pulse oximeter out there and good thermometer, and have those as part of your basic care to monitor yourself. But make sure that you don't just have them, but you have a sense of how to utilize them. And if you don't, make sure that you do all the research before you get those things. Next, I'm going to talk about pain level, and this one will be very brief. And pain level is referred to as the fifth vital sign, and it's more of a semi-objective measurement. It is totally dependent on a patient response and what the patient can tell you, and different patients will have different tolerance of pain, different level. They assess pain differently, some based on their level of understanding of pain. What is a high level of pain to someone, maybe a moderate level. So there's no clear objective way of doing pain level, but it's still a very pain level. However, pain level is still a very important tool in the assessment in medical care as a vital sign. Now, the presence of pain is very important because it gives us significant information about the type of pain, the location of pain, the character of the pain, the intensity of pain, and so many other ways pain can help us identify signs and symptoms of so many illnesses and diseases that can help guide us and help us to move in a direction that will be helpful in assessing and treating patient effectively. So pain level as it is very, very important. And even though it's not at that level where we could have accurate objective finding, it is very important. Now the VA, the Veterans Affairs, have put out a chart which is shown here, where for the most part, where you could see from mild, you're looking at from the pain level scale goes from 0 to 10, and from 0 to about 4 you have about mild pain, increasing to about moderate, and from about 4 to 5 out of 10 you have a moderate, sort of bordering and mild to getting to severe. And by the time you get up to 7, going up to 10, you start getting into severe pain. So this, you could see, it's a very, as I said, very semi-objective, but still very useful and a guide for assessment of patient. Now, as an interventional pain medicine doctor, I will be discussing many of these issues about pain and so many different things about pain management. Now, I've written one of the most comprehensive books on the subject of the opioid epidemic. I'll leave a link at the end of this video regarding that. But right now we've come to the end of the video series on vital signs. And what I'm doing basically is to cover some of these basic things, so at least you'll have some understanding when we're doing some of the things that are a little more complex and involve a little more. So I want you to always to have these videos available so that when we start doing those things, you will have them. Now, I encourage you to like, share, and comment in these videos. Let us know what you'd want us to talk about, topics. Let us know what you think about the videos. Give your opinion. I tell you, I will not be offended. Give your opinion. It will count. And I'll do my best to respond to some of those comments or most of those comments. So make sure you do that. Also, I encourage you to subscribe to this channel. And when you do, please make sure you hit the notification bell, because that way you will be notified each time we release a new video. Finally, let all of us always remember that each of us should strive to keep a healthy mind and body. Thank you so much for watching.